Hello, my name is Georgiana Johnson, and I was the speaker this past Monday at Mama Rising. So thank you for everyone who attended, for Alejandra for inviting me. The topic is infant massage. And so what I'd like to do is summarize all the ideas that I presented on Monday, and as well demonstrate the techniques so that others who were unable to attend can also enjoy the benefits of this. I won't go into all the details because it was about a 20 to 30-minute presentation. But to summarize, I'd like to say, as we move towards offering infant massage, please don't do infant massage on your baby if he or she is 4 weeks or younger. We want that time of development to occur first. What you could do is the same techniques, just based with energy. And so when we work with energy, we can start by rubbing our hands together. This generates some heat, some warmth, and that is a form of energy. And then the techniques would be done off the body, off the tissue, just a few inches away. And I hopefully will remember to go back and forth between touching the body and being off the body. We also want to really make sure that the umbilical area is completely healed if the baby is even over 4 weeks of age. If there is hernia or anything in this area, then hands off, no touching in the midsection if there's any challenges you believe or that you're working with a doctor to resolve. So those are some ideas that you want to consider as you move towards even these simple strokes that we're going to do, these simple massage and energy strokes that we're going to do. So I am a certified infant massage instructor. I'm also a longtime energy practitioner, and I'm really, really committed to offering families ideas so they can resolve everyday activity challenges, everyday things that happen, whether it's pain, discomfort, growing pains, too much energy, too little energy, trouble sleeping at night, letting go of the day and going to sleep. Just lots and lots of different ideas. I offer craniosacral for newborns. And you can find out more from my website, qiconsciousness.com, if you're interested. Okay, so the first thing that we would like to do is to get mama into her body, because there's so many things going on, so many different directions we have our attention. It's nice to settle into us. And the idea that I'm going to present today is to, here's my belly button. And so I'm going to take my attention, my awareness, to the best of my ability, down my body, inside my body. So it's about 2 inches below belly button, inside my body, a few inches, 2 or 3 inches inside. And as I do that, I just naturally take a deeper breath. And even now, as I'm speaking to you, I'm still aware and very connected to that area. This is a marvelous area. I mean, it has the umbilical, the belly button, the umbilical cord there, which, plays an important role as we're developing and growing and connecting to our mom in the womb. There's also the sacral chakra, for those of you who are familiar, or the second chakra, for those of you who have worked a little bit with energy. The dantian, tanden, the hara. So there's lots of names for cultures around the world that reference this particular area. So it's really nice. And this whole time, except for one moment or so, I have had my attention here. So you can see it's not something you have to close your eyes to do, although that's wonderful if you have that opportunity. But if you're watching baby and preparing, you're finishing the bath, getting ready maybe to offer a little bit of infant massage, whenever it is you schedule it in your day, then having some attention there, bringing yourself a little bit out of the head, more into the body. It's a calming, broadening experience. For me anyway. It might feel slightly different for you. Give it a try. And it's nice to be quiet. I have talked through it and yet still maintained that awareness, really bringing myself into my body. Okay, the next thing that we want to do is to ask baby if baby wants some body work. And this is really great to develop in the long run, because although these are infant massage techniques that I'm presenting, they can be used lifelong. So when the child is 3 and 5 and 10, of course, they need to be modified. Toddlers, songs or telling stories, that kind of thing, to engage the toddler to sort of be present while you do the massage would be really wonderful. We want to ask permission. And so I'll demonstrate what that looks like. And I don't have a lot of space here, so I'm going to just lift baby's legs up a little bit so I can get closer. Hi, baby. Would you like to have some body work? And then I wait for baby's response. If baby smiles, engages with me, gets excited, which can happen if I feel I get a yes and I do the body work, baby's going to learn that's what that means over and over. Even the first time, though, we've centered in our bodies and we approach baby with the question. Now, if baby is asleep, there's no consent. And so that would be a no. No massage while baby's asleep, because baby is baby's body. And by asking throughout her life if she would like to have some body work, then we're allowing her to choose this touch and when for her body. Okay, so let's say I have consent, or some other signals of non-consent would be baby turns away and gets really fussy, irritated. I mean, maybe baby has some gas that he wants to pass before he gets body work, or needs to nurse, or have a bottle. So we want to just stay connected to ourselves, which helps us to connect to baby, and we're staying present with baby, noticing baby's cues. Now, let's say that I ask and baby says yes. So from there, there's a technique that will support immunity, coordination when baby starts to crawl and walk and begin running outside and climbing things, that crossing over action, which is a natural part of our design. The brain energy, the brain processes cross to opposite side of the body. So we're going to do that by reaching across with whichever hand. I'm taking my right hand to baby's right shoulder, and I'm going to do a diagonal movement across. I have firm but not deep pressure. So I'm not trying to tickle baby with my light fingers. I'm just avoiding the belly button crossover action. And then I'll do it with my left hand to left shoulder. Back and forth. For infants, for young ones, maybe 3 on each side. It can be done more, but that's probably good to start with. Make sure that you're breathing, mama or papa. And then I've done more than 3 on each side. The next one that I'm going to do is for digestion. This one's a really important one, because there's a way for our elimination. I'm going to hold baby here just to demonstrate. So if I take my right hand and go into my right hip, so here on baby, that would also be there and there. Then our large intestine moves up on the right side, across, give or take a little bit under the rib cage. So I'm not on the rib cage, I'm just under it. And then down on the left side. I did say up on the right, across, down on the left, and then we eliminate. So we want to do that for baby. Now holding baby here, right and right. But as baby lays down, her right is me reaching over to the other side. So please make sure that you get baby's right side to go up, over, and down on the left. If we go the opposite way, then we're actually sending it back in. Now, energy-wise, I remembered, I'm going to come back to the X's. For energy, if your baby is 4 weeks or younger, or if there's something going on that you like, the umbilical area has not healed, or there's a hernia or some other condition, then just warm your hands up with some energy and do crosses above the body, just a few inches, nice, slow, and steady. Same thing for this. I'll continue with the energy idea. I would go up on the right, over and down. And I can use the palm of my hand, my fingers, breathing as I go. And I lift up and then move again to the right, and I'm crossing over. So very important. Okay, for touch on the baby, I use my fingers. And again, it's a firm, not deep touch. I avoid belly button. So I go up, I'm above the belly button, and I go down the left side. Okay, so for our last techniques, good for teething, breastfeeding, eating, speaking. Yes, we're going into the face. Again, 4 weeks and younger, let's do an energy side of this. So we'll rub our hands together, start close, and I'm going to show you on me so it's a little easier to see. Start close to the corners of the mouth and do outward circles, heading towards the ear, under the cheekbone. So on baby, that's what I would do. Again, this is not a light tickle touch. Energy-wise, it would just be above the body, on the body, firm, not deep. And on the face, maybe even a little more gentle than we did on the body. And then the next one is circles from the chin, the center of the chin, outward along the jawline. So these are two ideas for supporting breastfeeding, teething, speaking, chewing, drinking. So if you have challenges, will these resolve with these techniques? No, probably not. They can be supportive to therapeutic interventions like therapeutic body work of craniosacral. So if you have questions, let me know. My website again is QIconsciousness.com. QI is pronounced chi. So it's qiconsciousness.com. And on my website, you'll find one or more, plus a link over to the YouTube Family Friday videos, which apply to all ages. And they are quick videos made for adults to give you ideas on how to work with massage and energy techniques with your children to, again, resolve things like not being able to sleep well, or having trouble going to sleep, or needing to settle the energy, lift the energy, just get more centered to have a really brilliant, joyful day together. Thank you so much for watching, and I wish you fabulous adventures. Bye now.